Hi everyone. So we have a question here. The nurse is doing an admission assessment of a client with a history of duodenal ulcer. And to determine whether the problem is currently active, the nurse should assess for which of the following signs and symptoms. So if you have a duodenal ulcer, which of the following are the possible signs and symptoms? A. Weight loss. B. Nausea and vomiting. C. Pain relieved by food intake. And D. Pain radiating down the right arm. So if this is the question, you need to know what's the disorder about. So this is duodenal ulcer. So basically an ulcer is a wound inside your GI tract. So the duodenal ulcer means that the wound the wound is actually not in the stomach but in the duodenum, which is the first part of your intestines, right after the stomach there's the duodenum, so there is the wound. So when there's a wound or an opening, syempre masakit yan. When we wound or opening, masakit yan. The question is, alin dito yung signs and symptoms? 1. Weight loss. Tamang mali? Hindi weight loss. Bakit? Kasi pag duodenal ulcer, mostly hindi weight loss ang mangyayari. Pero there is a possibility of actually weight gain. Kapag gastric yung ulcer, which means ang ulcer ay nasa stomach, it means na pag kumain siya, yung wound na nasa stomach, exposed to food and hydrochloric acid, sasakit. Okay. So, dahil doon, pag masakit ang tiyan, kapag kumakain siya, kakain ka pa ba? Di ba? There's a tendency na hindi ka nakakain kasi alam mo na kapag kakain ka, sasakit ulit yung tiyan mo. So, therefore, the weight loss is not common in duodenal ulcer. It's common in gastric ulcer, wherein the ulcer is in the stomach. Okay, so eliminated na agad yung weight loss. Next is nausea and vomiting. So nausea and vomiting is common to ulcer, pero mas common siya sa gastric ulcer rather than duodenal. Ang common sa duodenal is mostly melena or bleeding in the stool, or yun nga, kasi since wound to may bleeding, but usually it's not found in the vomitus, right? It's found in the stool. Okay, it's an upper GI tract bleeding, so it's mostly melena. So nausea and vomiting is for gastric and not duodenal, mostly. Okay, pain radiating down the right arm. Why? So dun pa lang magtataka ka na, bakit kailangan sa right arm is stomach to, di ba? So eliminated na yung pain radiating down the right arm. The correct answer is pain relieved by food intake. Okay, bakit? Kasi when you eat, okay, and your ulcer is in the duodenum, so may sphincter sa pagitan ng so stomach and duodenum the pyloric sphincter. When you eat, magko-close yung sphincter, walang dadaan na food sa duodenum. Therefore, hindi ma-expose yung sugat sa pagkain and acid. So, ibig sabihin, kapag kumain ka at nawawala yung pain, technically... Hi! So, we have another question here. The question is about... The patient has a diagnosis of peptic ulcer, and which of the following findings is most likely an indication of perforation of the ulcer? So, the indication that the ulcer is already perforated. So, when I say perforated, it means na, diba, when ulcer, it means there's an opening or a wound doon sa lining ng stomach mo. When it's perforated, it means that nabutas na siya, in short. Okay, nabutas na yung tiyan, and technically, yung lahat ng contents ng tiyan maaaring lumabas na papunta sa ating peritoneal cavity, right? Kasi butas na siya diba? There can also be bleeding, and aside from gastric contents, hydrochloric acid or what, it can actually perforate na, and it can actually go out na from the stomach to the peritoneal cavity. So which of the following is an indication? So una, we have bradycardia. Number 2, or letter B, numbness in the legs. C, nausea and vomiting, and D, a rigid board-like abdomen. So, if there's a perforation, letter A, bradycardia is not likely a sign. Why? If there's a perforation, probably there is bleeding. At pag may bleeding, the patient is predisposed to hypovolemic shock, and technically, the BP goes down, heart rate goes up. So, hindi bradycardia, it's mostly tachycardia. Okay, numbness of the legs is not associated to ulcer. Not associated. So, isipin mo na lang, stomach ang problema natin, but the choices are giving you legs. So, it's lower extremities. Very, sobrang layo. Okay, so hindi. Nausea and vomiting, yes, there could be nausea and vomiting, but the question is most likely. So, among of the choices, which is most likely an indication. So, nausea and vomiting is very vague, and it can be attributed to a lot of GI problems or disturbances. Lastly, it's rigid and board-like abdomen. It's because since there are contents of the stomach that went out and nag-perforate siya, so lumabas na yung contents sa peritoneal cavity, and there could be bleeding, there could be infection in the peritoneal cavity, there could be peritonitis, and one of the signs that there could be peritonitis is a rigid board-like abdomen. So your abdomen is so rigid and board-like, and you can also check for signs of hypovolemic shock or septic shock. Yeah, so the correct answers are D for signs of perforation of the ulcer. Okay. Hi everyone, good morning. So the question, we have a question here again. It's another question about GI. So this is about a patient with liver cirrhosis. And then since the patient has a liver cirrhosis, which of the following is the most suggested diet, or which diet should be suggested by the nurse? So maraming ganitong tanong lagi sa board exam. Letter A, roast pork; B, cheese omelette; C, pasta with sauce; and D, tuna fish sandwich. So basically, let's review what liver cirrhosis is. So technically, pag liver cirrhosis, your liver is already damaged. And it's cirrhotic, it becomes hard, it becomes enlarged, hepatomegaly, and then cirrhotic means naging hard siya. And somehow, of course, your liver is damaged. It can no longer perform some of the functions. No? If you have liver cirrhosis, one of the things na alarming is the level of ammonia in the blood. Normally, your liver converts the ammonia to become bilirubin, and bilirubin is excreted in the body through urine or stool. So that's the normal process. But the problem is, if you have liver issues or liver problem, you cannot convert ammonia to bilirubin, and therefore they cannot be excreted by the body. Because ammonia is a bigger molecule, hindi siya pwedeng makalabas sa ihi or stool. Kailangan ma-convert siya into bilirubin. Since your liver is damaged, hindi na mangyayari yun. So, saan ba nagagaling ang ammonia? It came from protein. If you're taking too much protein in your food, it will be, it's the byproduct of protein metabolism. So, basically, if you're eating too much protein, the byproduct is ammonia. So, if your ammonia is too much, hindi mo ma-excrete sa katawan dahil sira ang liver mo, kailangan mong you have to manage your protein intake. Therefore, the question is about which of the following choices has a low protein amount. So, roast pork, of course, pork yan. Sa mataas ng protein. Cheese omelette, cheese has protein, right? It's a dairy product. What else? Pasta with sauce. Another D, tuna fish with sandwich. So, the other one is pasta. The other one is tuna fish. So, tuna fish has protein as well, right? So pasta, I think the most nutrient in pasta is carbohydrate, not protein. So if you're going to give food or suggest a diet, it should be low in protein and probably high in carbohydrate for energy. So it should be pasta with sauce, right? Right.